Good afternoon, everybody. My name is Josh Yoder. I'm the Director of Research Informatics Services. As Stuart mentioned, I'm with the Department of Biomedical Informatics. I'll be handling the first half of the presentation. My colleague Jeremy will step up after myself. About 45 minutes of presentation covering some informatics tools that we offer through the department, and then about 10 minutes for questions. So specifically, we'll be talking about the tools that you see here. REDCap, which is an electronic data capture system. RDR, which stands for Research Data Repository. This was recently released university-wide. You may have seen some messaging around it over the last few weeks. We'll talk about how to request research data from the information warehouse, which was discussed previously in today's talks. And then Jeremy will pick up with IHIS For Research and research registries. So first of all, REDCap is an electronic data capture system. There's several of these types of systems available. REDCap happens to be one that we offer most extensively here at the university. There are other tools around that can be used. Encore is one that offers more than just electronic data capture, but it's used within the Cancer Center, and that's being rolled out enterprise-wide over the next year or so. What does electronic data capture do for you? So instead of using an Excel spreadsheet, which Amy in the back is cringing just hearing that, you can collect your information through an online system. It's secure. It provides web-based surveys and case report forms. It allows you to export to several stat packages, including R and SAS and SPSS, and Stata, I believe, is in there. It has advanced features for data collection, including auto-validation, branching logic, calculated fields, etc. There's no licensing requirements, which is nice, so it's a very low-cost system to use. OSU is part of the consortium, which has built and supports REDCap, and it is installed in over 1,600 institutions across the globe at this point. And so it's fairly well used, especially in academic medical centers such as ourselves. So why would you want to use something like REDCap as opposed to Excel? I think that's fairly straightforward. It's web-based, designed primarily for research, though we do use it for quality and administrative purposes as well. It has integrated calendaring and scheduling for study events. There's no limit on the number of responses or number of questions. Data security, for those of you who are doing research within the human subjects domain, this is extremely important. We actually have two instances of REDCap. One is the PHI instance, which allows you to collect and store sensitive information, and that is housed behind the medical center firewall in the medical center data center. So it's in the same place that IHIS is stored. So you can imagine that there are many security measures in place to keep that data protected. Access rights within REDCap are defined at the project level, and within each project, there's a very atomic level of security that can be set so that your statistician has certain privileges which your CRA may not. The PI, of course, would have certain privileges which a data entry personnel might not. And of course, the data is regularly backed up using the same mechanisms that the data center uses to back up their information. Data can be accessed anywhere from campus. If you're off campus, you do need a VPN since it is behind the firewall. And the system does provide comprehensive audit logging, so you know who's done what with the data across time for your particular research program or study. There's several administrative tools which make the conduct of research much easier within REDCap, and so I mentioned calendaring and the export functionalities. You can import information from spreadsheets or other systems. There's a file repository which allows you to store study materials as well as share those materials with other members of your team. We talked about the user rights and data access groups, and so the data access group is interesting in that you can separate if you have multiple sites, you can separate the data within by which each of those sites can view it. I think Amy can probably explain that a little bit better than I, and please, if I say something wrong, correct me, Amy. E-signature and locking management, and then report builders, randomization. So there's a lot of tools in there which help you conduct your research in a more efficient manner. To give you an idea of what a data collection instrument looks like, the design looks like. Essentially, you're defining each question that you're asking either directly to the participant via survey or collecting via CRF. It's a fairly simple user interface to pick up and start using. Once you build your data collection forms, this is primarily how it looks when the data is being collected. A fairly simple user interface, easily understood by somebody who has not used it before. So especially if it's participant facing where you're having somebody fill out a survey, it's very straightforward, very easy to use. Of course, after collecting data, you're going to want to be able to get that information out and report on it. And so there are data export and data reporting functionalities. As I mentioned, data can be exported to something like a SAS or Stata data set and control file. There's some reporting mechanisms in here, but it's not a statistical data analysis package. So you will generally be exporting the data and using something like SAS to do your statistical analysis. So within the consortium, REDCap has released a library of forms. What are some of the examples that are in there, Amy? Promise forms. And so these are standardized data collection mechanisms, which you can simply go to the library and pull down that form, and essentially you're not having to build that form yourself. And so it's a time-saving mechanism. There's a lot of useful information out there. I'm not sure how well it's been picked up within the OSU community, but I know within the REDCap community at large, it's pretty regularly used. In terms of how to get training for REDCap, if you're interested, so there is online training, which you can take either at our REDCap installation here at OSU or through the consortium. We do have hands-on training that Amy leads and is offered monthly. An introductory course, which is intended for new users or novice users, appropriate for anyone who's not used REDCap before or somebody who needs a refresher. There's a REDCap advanced training, really intended for experienced REDCap users. Obviously, we would recommend that you take the introduction followed by the advanced training. And I believe we have rotating topics within that advanced training section. And then project-specific training is available, and so if you have a fairly complex project or it's your first time using REDCap and you want Amy to come in and really walk you through the use of the tool, then that can be arranged for. And so how do you request the services? I'm surprised that CORE hasn't been, or CORE was just mentioned actually, that's right. So you'll want to log into CORE, which stands for Computerized Research Record. Has anybody here used CORE before? Stuart has, all right. So CORE is really meant to be a central repository for all of the research occurring at OSU. It was launched 5 years ago. And it houses a lot of various services. So all the services you saw that were part of the voucher program in the previous presentation, those are all loaded into CORE. And so if you define your project within that application, you can then request various services from across OSU. Makes it very easy to get in touch with the right people to really launch your project off and start doing the things that you need to do to further your research. But for REDCap specifically, you'd create your project in CORE, go into the Request Service tab, and then search or look up through the folder interface for Biomedical Informatics program. And under Research Data Capture Tools, you can either specifically request REDCap, or if you're not sure if it's the right tool for you to use, you can request a consult, and somebody will be in contact with you within a few days. So next we're going to move on to RDR I2B2. As I mentioned, RDR stands for Research Data Repository. It's a database that's populated with a coded limited data set that's been extracted from the information warehouse. Is there anybody here who has used the information warehouse before to request medical record information? So one or two. So I'm going to assume that not everybody's familiar with the IW and just do a quick walkthrough on that. So the Wexner Medical Center has an EDW, an Enterprise Data Warehouse. For those of you not familiar with the data warehouse, it's really a central repository of various information for any organization. So in our case, that includes things like IHIS, the underlying technology is Epic. So all the information that is in the medical record flows into the information warehouse on a repeating basis, and as well as other ancillary systems, both clinical and administrative. And so there's billing information in there. There's information from a number of systems. And so what we've done with the RDR is taken that electronic medical record data, through an IRB-approved protocol, have extracted this coded limited data set and pushed it into a tool that's called I2B2, and I'll cover I2B2 in a second. The RDR framework allows for self-service cohort discovery. And so through the tool, you can ask a question in terms of a population of interest from the Wexner Medical Center. It covers 5 years of information. We use a rolling 5-year window. It has information such as, I'm not sure how much I cover in terms of what's stored in there, but procedures, medications, most of the information that you would want to use to define a cohort can be found in there. We expect that through the use of this tool, you'll be able to identify cohorts. It should support the hypothesis generation and feasibility analysis. And then most importantly, being able to complete study population enrollment reports in a self-service manner. And so when submitting a grant, many times you're asked to fill out one of these enrollment reports. The historic path was having to contact the IW and go through that process. If you have access to this tool, you can then do that by yourself without necessarily having to contact an analyst. The RDR here at OSU is implemented using I2B2. It's available for use by the OSU Biomedical Research community, and that's very specifically defined. So it's faculty and staff, not students, affiliated with the medical center or one of the 7 OSU health science colleges listed here. Advantages that we expect RDR will bring to the institution, supporting an increased number of research applications, minimize the administrative burden, both on the researchers who need that information to submit grants, but also on the information warehouse in terms of analyst hours and the kind of back and forth it takes between those two groups to really get to the answer that you're looking for. Enable cohort discovery and study feasibility, of course. Providing access to aggregate data to expedite the conduct of high-impact biomedical research, and then increasing the transparency of what data is available to researchers. And so through the tool, the ontology really surfaces the type of information and the way that that information is stored within the information warehouse. So a lot of times researchers will come looking for information, but they're not sure what's actually available to them. By using this tool, you can look through the ontology and identify exactly what data points are available to you as a researcher. So it's very important to note that the tool itself provides you an aggregate count of patients, and so you're not going to get to an identified data set or a limited data set through this particular tool. It's really meant to allow you to define a cohort and identify within the patient population seen here at the medical center, how many patients have we seen that meet those criteria.
Josh?
Yes.
I think Mark Hall in his grant writing presentation went quickly through a requirement for many NIH grants of underserved populations. And so you can use this to fill out the charts there and show that we do have these populations and the possibility of...
Yeah, I think he had shown one of the enrollment reports in his presentation, and that's exactly what this tool should help you be able to fill out. As I mentioned, the RDR is implemented using I2B2. This is a framework. It stands for Informatics for Integrating Biology in the Bedside. It's funded by the NIH, established in 2004, and the consortium is based at Partners Healthcare System in Boston. Currently, 49 CTSA institutions have this installed and running at their institution. OSU is one of those 49 now. And then it's used by 34 non-CTSA academic health centers within the United States, and then 26 international/biomedical companies elsewhere. This is just to give you an idea of what the user interface of I2B2 looks like. Is there anybody in the room that has access to I2B2 or has signed up for a course? So one. I would highly recommend that if you're doing human subjects research that you at least look at the tool and see if it might be something that's useful. There's a required training class that you'll go to when you request access. We walk through the user interface and how to use the tool, but you really don't have to have a lot of informatics experience to be able to log in and start generating queries from the I2B2 interface. As I mentioned, it returns aggregate numbers of patients, and it is a secure presentation of the information specifically for research purpose. So the types of information available within the I2B2 ontology includes demographics, which is most heavily used, provider information, encounter, diagnosis, procedures, lab results, medications. And so there are various domains of information that you can use to build a cohort within the tool. There's restrictions on ages, so anybody who's actually over 89 will simply show up as greater than 90. In terms of access and security to RDR, as I mentioned, for faculty and staff of the medical center or the health science colleges, in order to access RDR, you need to request access, of course. You need to complete a training session. There's a post-training exam, and then signing of a data use agreement. These are all things that are laid out within the IRB-approved protocol, which allows us to operate the RDR here at OSU. Important to know that the web client utilizes the Medical Center Active Directory account system, and so all users need a Medical Center account. It's the standard username. The password is case sensitive, so lowercase. In order to access it, you must be on the Medical Center network or be on the VPN. That's important to note for those who are not, who do not have a Medical Center account. That's a fairly lengthy process. And so if you're interested in getting access to the tool, of course, sign up for the training class, but indicate that you do not yet have a Medical Center account. We can help you through that process of gaining access. And then, of course, use of the system is audited. So requesting RDR access, probably having the link to here does not help, but if you search on the OSU website for RDR or I2B2, it'll bring you to our splash page, which has the training dates defined, or you can just email the email address that's shown here, and we'll get some information out to you. If you're working on a specific project and you have access to I2B2 and you're trying to define a complex query, we also offer consultation services around that. And so you can go into core where your project should already be defined and then search for the service of Research Data Repository I2B2 Consult, and somebody will come out and walk you through the process. Now, RIW Data Request. So the RDR framework allows you to define a cohort. The next step is usually, well, I need some actual information as opposed to just patient counts if you're really trying to dig into that medical record information and data. And so the next steps here are actually doing a request for information from the Medical Center Information Warehouse. The type of data, as I mentioned, that's in the IW is very similar to what I'd mentioned is in I2B2, and so encounters, demographics, more detailed information across many more systems. And so generally, it's best to work with an IW analyst to know what type of data is out there, especially if you're submitting your protocol for IRB approval. You probably want to make sure that what you're asking the IRB to see, you're in reality going to be able to get to. And so even before IRB approval is gained for a specific protocol, you can put in a consultation request with the IW team to make sure that the data points you're most interested in are actually available and feasible to pull out. Research data requests have various categories. And so RDR provides a, really it's not even human subjects research because it's just a count of patients. So it's a summary of patients. It's really preparatory to research type of information, not considered human subject. Of course, you don't need a specific IRB approval or what's called an honest broker submission to get to that information. You just need access to the tool. Beyond that, here at OSU, there's an honest broker process that's in place, which again, you can request through core. Which allows you access to a de-identified or coded limited data set without having IRB-specific approval for a project. And so that's probably important to note, right? The IRB process is fairly lengthy. And if the research you're doing really only requires de-identified or limited data, this is a great opportunity, a great mechanism to use to get access to that information. Again, there's an IRB umbrella protocol which covers this work. So every IW data analyst that pulls information out of the IW for researchers goes through very specific training and understands their role as an honest broker between the identified medical record and the researcher to make sure that OSU is following all procedures and requirements for doing such. But as a researcher, it really allows you to get access to data much more quickly. Of course, it's retrospective only, so you're not going to be doing prospective data collection under this mechanism. And then for identified data or prospective data collection, IRB approval is required. Once you gain that IRB approval for your protocol, you would put a request into core to have an IW analyst work with you to pull that information out of the information warehouse. Digging into the honest broker protocol a little bit, de-identified or coded limited, these are standard industry terms. So if you're unsure what those are, you can actually just do a Google search and it'll pop up for you. We talked about de-identified, well, we talked about both of these actually earlier in the day. So the process there, researchers sign a data use agreement with the IW. The analyst prepares the data, stripping out PHI. In the coded limited data set, there's some identifiable information, but generally it's still hard to re-identify the individual from that. The example would be a zip code. Requeries are not allowed. The limited data set, the date, zip, and age over 90 are kind of the identifiers which are allowed in those. And then a data set which results in less than 25 patients will not be returned to the researcher. And then that's a threshold based on small populations. As I mentioned, less time intensive, allows for conduct of feasibility, as does RDR. So it's possible that the cohort you're interested in is too complex to be defined within the I2B2 interface. In those instances, you would want to make an IW data request directly to an IW analyst through core. May alleviate the need for conducting manual chart reviews. In many cases, I think that's true. So data requests for research purposes. Somebody asked earlier about quality or operational intents and purposes versus research. And so the quality and operational realm have different regulations or different oversight mechanisms. As soon as you get into the research realm, of course, there's very specific scrutiny that comes into play. The requirements here is that your project be defined in core, can be requested, imaging or data can be requested through the information warehouse. We have some hands-on triage that occurs to ensure that the request is in line with the approved IRB protocol, and then requests are serviced by either somebody on the Biomedical Informatics team or the IW team or Imaging Informatics. And there's other teams at the medical center and university who may service those requests as well, but we act as a central intake and organizer of the process. As I mentioned, core is the place to go to request these services. I believe that brings up Jeremy.
All right, am I on? Sounds like it. Thank you. So is everyone awake after lunch? Let's test. OH! Okay, you're not awake. Fantastic. So, IHIS For Research. Basically, the important thing to know is if you want to do anything that has to do with EPIC, the IHIS system here at OSU, it's our medical record, our electronic medical record, come talk to me. We do modifications directly in the chart. We work with both our physicians and our faculty to identify ways that we can actually further the research that we're trying to accomplish here at OSU. We also release a number of different capabilities standardly to our research community to help support what you're trying to accomplish. Some of those discrete areas are we do work a lot on discrete documentation. A lot of the things being charted in the electronic medical record are free text and they are completely useless without a chart audit. and having someone go in and retype it all into a spreadsheet. And so we rework workflows so that it all starts getting captured discreetly. We work with protocol adherence. Subject recruitment is a big one for us. And finally, subject tracking and retention. We do a lot of reports directly in Epic so that we can work with you. That's basically it for Epic and IHIS. Like I said, email me if you're interested in finding out more. So research registries. Research registries can take a lot of different looks and feels to them, and we're going to focus very specifically on a tool that the CCTS and Biomedical Informatics recently released. But some of the registry information that you may hear about here at OSU includes our informatics solutions, such as where we've embedded registries directly in our electronic health record. Those tend to be more surrounding specific patient populations where you're trying to both treat a disease and do research on it at the same time. We've got embedded directly in our CTMS, that's the Encore system. Those in the Cancer Center will have used it a lot more. Encore for the enterprise is going live next month. We've got custom-built systems such as the OSU Total Cancer Care Protocol and some other repositories out there. Some of the key considerations that we want you to think about is if you're trying to do a research registry, trying to pull all this data on a specific patient population that you're recruiting, subject population, is it going to be single site? Is it going to be multi-site? Is it going to be centralized or a distributed data model? Centralized is it's all going to one central location. Say we're working with 5 other universities, it's all coming to our center here. Or if it's distributed, everyone keeps their own data, but you're able to request at multiple locations. Lots of complicating factors, such as are you trying to store images or biospecimens? And like I said, we've recently released a new tool that we specifically wanted to highlight called our Research Registry Pipeline. I think I've got 2 different mics on at me at the same time, and that's why I'm getting a little bit of an echo. All right, can everyone hear me still? Fantastic. Hang on one second, because I'm going to go into a live demo. Live demos are dangerous, as you all know. We'll see if this all works for me. So this is our new research registry pipeline. You log in with your normal credentials. And because I'm an administrator, I can see all the different ones that we've actually brought live here at OSU. Diabetes is our demo registry. Right here, I can click my magnifying lens, and I can actually see past queries that I've specifically saved so that I can go back in and find them again. The important thing with our research registry pipeline is it's tied directly into your Epic database. So you go into IHIS, go into Epic, you flag the patient chart, it will automatically be flagged in the system, and the next time we update the research registry, it's going to have that additional information directly from your patient in the registry. You'll be able to start doing your analytics and closer to real time. It gives you a database that's based on the OMOP standard. It's a standard database ontology, which means that we're able to share with other organizations who are also coding all of their Epic data or Clarity data or REDCap data into this OMOP ontology. It's just a very nice, streamlined way to let multiple institutions work towards one central goal of being able to use data across multiple systems. So if I click on my diabetes registry, it automatically pulls in, and it's a very fantastic screen, right? Actually, what it does is it gives me the option of selecting what tables that I'm interested in. So I could say care site, and I can say search, and it's going to show me all the different care sites here at OSU. Lots of null values because, again, this is our demo database. But care sites are usually not who we're really interested in. We're really interested in a person, a subject that we've signed up. And so here you see we've got 9,500 entries. You're able to scroll through them. Because it's de-identified and coded, we've got a very interesting string for our person. But we're able to see lots of details around them, such as their birth year, birth month, day of birth, gender, ethnicity, and that type of thing. And let me scroll back up. So, because I'm no fool, I went ahead and created a couple queries that I specifically wanted to show you. So we're going to start with metformin search. When I click on my saved search, it automatically pulls in my drug exposure, medication, and my source value. I've said I want it to be like metformin. Here you can see we've got 49,000 entries that it's pulling in. Again, we'd be pulling this directly from your electronic medical record and being able to update. What's really cool though is you saw here where we've got many different tables available. I can actually just hit the plus button and I can actually link directly to my person table. And I'm going to do a really simple query. The person ID is not null. And I can say search. And nothing changes. But if I click on this main table columns to be returned, so I'm going to say drug medication source value, medication start date, I actually have the person table then, and I'm able to link in the person ID, the date of birth, month of birth, and search, and it joins those two tables directly for me so that I'm able to see the data that I'm most interested in on this research registry. We also have the ability to do exports. So it exports it directly into an XML file, allowing you to work with that in your statistics packages in Excel, whatever package that you're most interested in. I was playing around with a different query. I think it was creatinine greater than 4. And you'll see here where I've taken my observation source value, like creatinine, observation results is greater than 4, and I've actually added visit occurrence is not null, so I'm able to link in my visit occurrence table. Oops. Visit occurrence is not null. So it's doing its little thinking box. And when you're dealing with 200,000 results, it can be a couple seconds long. I think this one, 18,000 results. But then I'm able to link in my person ID, my visit occurrence ID if I want. And I'm going to go ahead and select my observation ID, source value, result as a number, say search that. So I still have 18,000 entries. I can actually just click export. It takes a couple seconds. It's about a 3 megabyte file, but it's a very simple, easy methodology for you to actually be able to use these directly, have it all in a format that's actually usable for you, and gives you a lot of control over the data and the services that you're trying to accomplish. Let's see. Obviously, because I'm saving these, you're able to save these and change the name, update them however you want. You're able to choose whether or not you want this to be a shared search or something that is only accessible to you. The search is run independent of the data retrieval each time, so you're able to save a search, the database updates, you run the search again, export it at a new time. What other key highlights are there that we'd like to call out? I think that about covers the main ones. We do have a training session where we work with you directly if you've got a research registry, identified patient population that the IRB has given you permission for, where you can get access to this tool. The tool is a flat $10,000 rate. We do have the ability to start pulling in not only the EPIC data, but we can also merge REDCap data directly in, and it's something that we're happy to work with you on. And because I know some people, it makes it a little easier to understand what we're doing with an image. This is kind of the image of what we're doing. We're pulling the information warehouse and REDCap into one central repository that our biostatisticians and bioinformaticians can actually access. You can access it directly from your computer with this real-time query engine. And that's about it for us. If you're interested in it, please email us. You can email Jeremy Harper at osumc.edu, Josh Yoder, the CCTS. We can also request it directly in core. Easiest is to request it in core because then whoever's on site that day will actually get back to you immediately. But
I had a question about REDCap because I know I get emails regularly from Amy
Sure.
that trainings are available. How do people get on that email list where they might learn about when introductory or advanced trainings are coming up?
It is listed on the CCTS website, and you can also request it through core, just a consultation and some information on REDCap. But we do have a training next Friday from 9 to 10 a.m., and it's an introduction to REDCap, so it's just perfect for anyone that hasn't had to use REDCap. And it's a lot of fun, and it's a new training class that I think would really be helpful for anyone. Does anyone have any questions about REDCap?
And I would add to that, if you're not a CCTS member already, I would highly recommend it. And so it's free to do that. It's basically you go on the website, fill out some information. But a lot of this type of information, when our trainings, what tools are available on the website. And then there's also email newsletters that come out which have very helpful and useful information.
other questions?
Hi. So I was wondering, can you import data or import databases into it? Like if you've been keeping a database in Excel on a study that's been ongoing over a period of time?
Yes, we can create that database for matches, and if you can variable, we'll sit down and work on it. But yes, you are able to import it into it. Sorry, loud. I don't know.
So I had one other question about
Yes.
that too, which is that like when you're doing an IRB application, we've always used the standard language, like we'll be storing our database on a secure, password protected
Right.
network drive. When we put it in Excel, does the REDCap count for that? So you can.
No, you actually put it into your IRB. I actually have an IRB little quote from REDCap that'll allow you to do that. We also put that quote on CCTS that you guys can access. It's easy to put in your protocols.
To put in the
So
protocol.
definitely, but you definitely need the REDCap in your protocols when you're submitting to the IRB.
And you can use it for prospective data collection where you
Yes.
do have identifiable
Yes,
data in
you
there?
can.
Okay, thanks.
You're welcome. Just a keynote, this is becoming a really popular thing. REDCap is awesome for multi-center institutions. So anyone that's doing any multi-center, it's a great use to use it for that, where you can actually keep data separate from each institution, but then able to view the data as a whole in one spot. So it's really becoming a popular thing when using multi-institutions. We have sites in other countries that are doing it, so you can use it in multiple settings at different institutions, different countries. So it's something to really think about as you start to grow your research and become really popular.
I should mention it's also not only multi-country, multi-site, but also multi-language, right?
Yes,
So-
very multi-language.
You'll actually be getting a REDCap survey in the next day or two asking you questions about this program. So I hope you'll fill out that evaluation, but you'll see how it works as a survey.
Will that be English or Spanish?
If you'd like it in Spanish, let me know and I'll. Any other questions? Well, let's thank our informaticians for coming to us today.